Hi, I'm Ed Jacobs, founder of Impact Therapy, and I'm here with Heidi O'Toole. And we're going to discuss the use of impact therapy in group counseling with addictions. Both Heidi and I have do workshops around the country on group counseling. Heidi does a lot on group counseling
In
in
addictions.
addictions.
Yes.
So why don't you talk about how impact therapy and groups go together
Well, impact therapy in groups really, I mean,
in addiction?
but just making your groups more engaging, involving more members, having a structure, and then involving the members by using multisensory techniques and strategies.
An example would be if you pick up a hammer and say, you got to quit beating up on yourself because of your past addictions. That's what you're meaning by
Absolutely.
multisensory.
By being multisensory. It also makes them more dynamic. Groups are predominantly the therapeutic process in addictions counseling, in treatment centers, in residential, in outpatient. You have more than therapy groups. You also have psychoeducational groups, which is
That's a big
part of addictions counseling in residential treatment and also in community. You have prevention groups in the school systems. You have preventions in the community. You have relapse prevention groups for intensive outpatient, treatment outpatient treatment. So to run as many groups as demanded of you in the addictions field, it's really important to come up with ways in which your groups offer the members the opportunity to change. And if you're just sitting around talking about the addiction or talking about what you could possibly do differently, it's just not as effective as if you involve the members.
Well, a couple of other things, because I've written a book called Group Counseling Strategies and Skills. And in that book, we talk about cutting off, which is the same thing as impact therapy in the sense of the depth chart, taking your session deeper. Because if you don't cut off group members, especially alcoholics and those, they can talk and tell
stories, and they can also be very resistant. You have a lot of mandatory
clients. So you
clients.
teach cutting off
in our workshops. It's an essential skill, especially with this population. You have both sides of the spectrum. You have people who just want to tell stories, stay stuck in their past and you also have people that are so resistant because they don't want to be there. It's imperative you cut that off, or else it compromises not just the quality of the group, but the safety of other group members. The other piece in addictions group is what you talk about in your book, is drawing members out. Many of these members have been anesthetizing their emotions for several years. They are not socialized, especially if you have a group that's predominantly people drug addicted. That addiction is more of a withdrawn addiction as opposed to alcoholism, where you see that's more of a social addiction. And so it's necessary to draw those people out, which is a skill that you talk about in your group book.
Yeah. So when you do a workshop, you teach creative techniques, and we're going to do a clip on a bunch of those here.
I teach how to structure and design your groups, which comes from your book. And then why I teach that is know where you are, what phase of the group you're in.
You don't just wing it?
No, you plan. Planning is just absolutely essential. I have to plan. I have to be prepared for that group. I have to be competent in the content that I'm going to be presenting.
I think, because when I've done workshops, and I know you and I have talked about this, and we've done them together, a lot of the people leading the groups, it's almost like they play bad cop.
Right.
They
referee.
Or they just want to.
They just want to beat. They almost as if they beat up on their group members.
Yeah.
As opposed to, I remember doing a workshop, and the gentleman came up to me on the break. It was a group counseling workshop, creative, strategies, and he had tears in his eyes. And I said, may I be of help? He said, I've been beating up on my group members my entire career. But he just didn't know how to do it differently.
Yeah.
And see, this approach offers clinicians, people who run even psychoeducational groups, it offers you a way to do it differently and be more effective.
Well, because the name impact therapy is what we talk about a depth chart. 10 is the surface, 9, 8, 7 is going deeper. And you want to have impact and take it below 7. Yeah.
And in a group, that's the working phase of the group. I've got to come up with a topic, which means I've prepared for my group. And then I want to introduce an activity or an exercise which will show creatively, which is going to relate directly to that topic and the overall purpose of that group. And then we process the group. We process the activity, how that relates to their direct life experience. Many groups, we've encountered this in our workshops as well, people will spend 20, 30 minutes doing the activity, but they don't process the activity. And that's really the piece where I think your approach to groups is so much more effective, because the activity has got to relate to what it is they're doing.
I remember we did the workshop with the women at the halfway house,
Yes.
and we used the rear view mirror.
Yeah.
You know, and just holding it up. And
Holding it up and saying, if you keep looking at your past or focusing on your past, you're going to crash and burn. You're not going to be able to move forward.
Yeah.
And really, when we equate it,
and that's a big one in addictions.
In addictions, you get stuck in your past.
Yeah.
You absolutely get stuck in your past. That's the reason that you used, because you had so many painful occurrences in your past. So you tried to change how you feel or block it out.
Grab the little chair.
Sure.
I would say these are the two, and then how we're trying to help people get out of the little chair.
Get out of the little seat. Again, this is the image of somebody in an addiction. And whether it's drugs, alcohol, gambling, sex, shopping, internet, you do it from this ego state, this child state that's needy. That needs the needy. They don't have anything to attach to.
And I think why we use props is it gets, and especially it's good for groups because it gets everybody's attention.
Everybody focuses.
Because that's the hardest thing is.
Well, you have 8, 10, 12, and in psychoeducation groups, you may have 20 plus people in your groups. And that's why in the psychoeducation groups, I stand up. I even use props to where I stand up because it's more of a classroom style. And I do things like this. I say, if you drink like this, it may or may not be a problem. If you drink like this, it's a problem. May or may not be.
One a night,
right.
Not a problem.
Maybe not a problem. Drink like this, it's a problem. So I engage all of those people, and they're thinking about how they drink, you see. Yeah. And so even though you're in a large group setting, people are really able to process it as according to them.
And you and I believe, and I know you teach them, and so do I, the skills that we write about in our, there's a lot of skills, essential leadership skills. And there's on the web page, on impacttherapy.com, there's sets of handouts that you're welcome to on group counseling. Mm-hmm. Not specifically on addictions group, but you use many
just
of those.
effective group strategies and skills. It's a complex process when you have a group of people versus just having one individual in an individual setting.
Yeah, but what you believe and I believe is if you've got skills, got theory, are willing to be creative,
right.
You can lead effective drug and alcohol groups. Because what I hate are these people that say they do DUI groups and they're terrible.
Right.
Well, because those are difficult groups.
They're very difficult.
But you've led them, and I've trained people to lead them, and they've led them where they were effective.
They've led them well, and the members change. You set forth in motion that process. And you do that by engaging, and when you engage, you really increase the opportunity for members to retain what it is you're talking about in the group setting.
Okay. For more information about impact therapy or about group counseling, you can go to the webpage impacttherapy.com.